If you're over 60, what I'm about to reveal will shock you. After interviewing hundreds of healthcare workers, I've uncovered the disturbing truth about what doctors really think when treating seniors. These 5 ugly realities are costing you proper care, respect, and potentially years of your life. One retired physician called it the healthcare industry's worst kept secret. Don't let another medical appointment pass without knowing what's really happening behind closed doors. This could save your life. Welcome to Life Advice for Older People. What you are about to learn will fundamentally change how you approach healthcare forever. Today, I'm exposing 5 brutal truths about medical ageism that the healthcare establishment desperately wants to keep hidden from seniors. Here's your roadmap. First, the shocking mental shortcuts doctors use the moment they see your age on the chart. Second, the disturbing economic calculations happening during your treatment decisions. Third, why your symptoms are being filtered through dangerous stereotypes. Fourth, the prescription practices specifically targeting older patients. And fifth, the most heartbreaking assumption about your cognitive abilities that's affecting your diagnosis quality. But here's the empowering part. I'll reveal the exact strategies successful seniors use to flip these dynamics and command premium healthcare. If you've ever felt dismissed, rushed, or talked down to by medical professionals, this video will arm you with the tools to never experience that again. Hit that like button right now if you're ready for the truth. And make sure to subscribe with notifications on, because this information could literally save your life. Comment below with your biggest healthcare frustration. Let's begin. They mentally label you as expensive and complicated before you even speak. The moment you walk into a medical office, your age triggers an immediate mental calculation in your doctor's mind. Healthcare professionals are trained to assess resource intensity, and seniors automatically fall into the high-maintenance category. This isn't malicious, it's systematic programming that affects every interaction you'll have. Dr. Sarah Henderson, a former emergency room physician who now advocates for senior rights, revealed the disturbing reality. Medical schools teach efficiency protocols that essentially pre-categorize patients by age groups. Seniors are assumed to require longer appointments, more tests, and complex medication management. This creates an unconscious bias before the examination even begins. The financial pressure, well, it really intensifies this bias. With insurance reimbursements on the decline and patient quotas on the rise, doctors these days feel a lot of economic stress when treating older adults. Your comprehensive health needs often clash with their limited time, and honestly, that creates a kind of resentment that can affect the quality of care you receive. Studies have shown that doctors spend about 23% less time actively listening to patients over 65 compared to younger patients with the exact same symptoms. Let's consider what happened to 74-year-old retired librarian Maxine. She turned up for her appointment armed with a detailed list of symptoms she'd been tracking for weeks. But before she could even finish her first sentence, the doctor cut her off, saying, "Let's focus on your main concern today." When Maxine tried to explain that her symptoms were all interconnected, the physician just sighed and said, "We need to prioritize." Her chest pain was brushed aside as anxiety, which ended up delaying a cardiac diagnosis by 6 months. This so-called complexity aversion goes beyond just managing time. Doctors often shy away from ordering comprehensive tests for seniors, assuming the results will uncover multiple issues that need extensive treatment plans. Frankly, they'd rather treat the surface symptoms than dig deeper and risk finding systemic problems. The psychological impact of this is, well, quite profound. When healthcare providers come to you with these preconceived ideas about difficulty and cost, they're just less likely to work with you on a collaborative treatment plan. Instead, they tend to stick to standard protocols meant for so-called typical senior issues, rather than really investigating your unique situation. Right, so here's how to combat this bias immediately. Start every appointment by stating your specific, measurable health goals. Instead of just saying, "I feel tired," try something like, "My energy levels have decreased by 40% over 3 months, and I want to identify the cause." This, transforms you from a so-called complicated senior into a goal-oriented patient in their mind. Bring along a concise one-page health summary that highlights improvements you've made through previous treatments. That way, they're showing you're an active participant in your healthcare, not just a passive recipient of services. Doctors honestly respond more positively to patients they see as partners rather than problems. And don't forget to request specific timeframes for addressing your concerns. For example, you could say, "Doctor, I understand we have limited time today. Can we schedule a 30-minute appointment next week to thoroughly discuss my cardiovascular concerns?" This shows respect for their schedule while at the same time advocating for appropriate care. Also, make sure to document everything during appointments. When doctors see you taking notes, they realize you're paying attention and will likely remember details. This sort of accountability, well, it really does change their behavior and communication style quite a bit. They use what you'd call polite medical gaslighting to dismiss your symptoms as just normal aging. Medical gaslighting targeting seniors has unfortunately become so commonplace that healthcare professionals often don't even recognize they're doing it. When doctors attribute legitimate symptoms to normal aging, they're actually using a socially acceptable form of discrimination that, sadly, delays proper diagnosis and treatment. Dr. Michael Torres, a geriatrician who spent his career fighting ageism in medicine, explains it this way. The phrase "you're getting older" has become a medical cop-out. It's used to dismiss symptoms that would trigger immediate investigation in younger patients. This isn't evidence-based medicine, it's age-based assumption. The statistics are, well, honestly, quite alarming. Research from the American Geriatric Society shows that 85% of serious conditions in seniors are initially attributed to aging before receiving a proper diagnosis. Heart disease presents as, fatigue from getting older. Thyroid disorders become normal energy decline. Depression gets labeled as adjustment to aging, and cancer symptoms are dismissed as just wear and tear. Take 67-year-old former construction supervisor Carl. For 8 months, he complained of increasing joint stiffness and fatigue to his family doctor. Each visit resulted in the same response. "Carl, you're not 30 anymore, your body is slowing down." When Carl finally demanded blood work, they discovered severe rheumatoid arthritis that had been causing permanent joint damage during those dismissed months. The gaslighting follows, well, pretty predictable patterns. Doctors use phrases like, "at your age that's expected," or "we all slow down" to redirect conversations away from actually investigating symptoms. They'll recommend generic solutions, more exercise, better sleep, stress reduction, without determining why these issues developed so suddenly. Women face double discrimination, with symptoms dismissed as both aging and hormonal changes. Men's complaints about sexual health or emotional changes are brushed off as normal male aging. Mental health concerns get particularly dangerous treatment, with depression and anxiety attributed to life stage transitions rather than investigated as medical conditions. The most insidious aspect is how this gaslighting makes seniors doubt their own experiences. When authority figures repeatedly tell you that concerning symptoms are, quote, normal, you begin questioning your own judgment. This self-doubt delays medical help seeking, and honestly, it just worsens outcomes. Here's your defense strategy. Always respond to age-based dismissals with specific questions. When a doctor says that's normal for your age, ask, what percentage of people my age experience this exact symptom? What studies support that this level of, symptom is typical? Most doctors can't provide evidence because they're making assumptions, not medical assessments. Create symptom timelines that demonstrate sudden changes rather than gradual decline. Instead of saying I'm more tired lately, present data. My energy levels were stable until March 15th, when I began requiring afternoon naps for the first time in my life. This transforms your concern from an aging complaint to an acute onset symptom. Request specific diagnostic criteria. Ask, what tests would you order if I were 40 with these same symptoms? This forces them to justify different treatment standards based solely on age. Often they'll realize their age bias and order appropriate investigations. Use the concern escalation technique. State clearly, doctor, I understand aging affects energy levels, but this represents a significant change from my baseline. I'm concerned this could indicate an underlying condition. What diagnostic steps can we take to rule out medical causes before attributing this to aging? Bring an advocate to appointments. When another person witnesses dismissive behavior, doctors modify their responses. Your advocate can ask follow-up questions you might miss and help document the conversation. Are you seeing a pattern here? If you've experienced this kind of dismissive treatment, let me know in the comments below and smash that like button if this is resonating with you. They secretly believe you're mentally declining and won't follow complex treatment plans. One of the most damaging assumptions in senior healthcare is the presumption of cognitive decline. Doctors routinely simplify treatment explanations, avoid complex therapeutic options, and make medical decisions based on age-related intelligence stereotypes rather than individual assessment. Dr. Amanda Richardson, a neuropsychologist who studies medical bias, reveals the shocking reality. Healthcare providers consistently underestimate cognitive abilities in patients over 65. They'll recommend simpler, less effective treatments because they assume seniors can't handle sophisticated medical regimens. This creates a devastating cycle where seniors receive suboptimal care due to unfounded assumptions about their mental capacity. The impact extends far beyond hurt feelings. When doctors believe you can't understand complex treatments, they don't offer cutting-edge therapies, detailed treatment options, or comprehensive diagnostic procedures. Instead, they default to basic interventions that require minimal patient participation or understanding. Consider 71-year-old retired chemistry professor Louise. When diagnosed with early-stage breast cancer, her oncologist immediately recommended a simple mastectomy without discussing reconstruction options, targeted therapies, or clinical trials. He explained the decision by saying, "At your age, we want to keep things straightforward." Louise had to fight for months to access the same treatment protocols offered to younger women with identical diagnoses. This cognitive prejudice manifests in subtle ways. Doctors speak slower, use elementary vocabulary, and provide oversimplified explanations to seniors regardless of education level or demonstrated intelligence. They'll skip technical details that would help you make informed decisions, assuming you won't understand anyway. The medication management assumption is particularly dangerous. Healthcare providers often choose less effective drugs with simpler dosing schedules, believing seniors can't manage complex medication regimens. They'll prescribe once-daily medications that are less therapeutic than multi-dose alternatives, prioritizing perceived compliance over optimal outcomes. Technology discrimination compounds the problem. Doctors assume seniors can't use health monitoring apps, electronic medical portals, or digital communication systems. This assumption cuts you off from modern healthcare tools that could improve your treatment outcomes and communication with providers. The self-fulfilling prophecy becomes tragic when seniors internalize these expectations. After repeated experiences of simplified explanations and dumbed-down treatment options, some seniors begin believing they can't handle complex medical information, creating actual dependency where none existed. Right, so here's how to shatter these assumptions immediately. Begin every medical conversation by stating your educational background, your professional experience, or any relevant expertise you've got. You might say something like, I managed complex projects for 30 years, so please give me the detailed medical information I need to make informed decisions. Don't hesitate to ask for technical explanations using proper medical terminology. For example, you can request, Doctor, can you explain the pathophysiology of my condition and how each treatment option addresses the underlying mechanisms? This really shows your desire and, well, your capacity for sophisticated medical information. Bring along evidence of your cognitive abilities, maybe articles you've researched about your condition, questions you've prepared based on medical literature or notes from other specialists. This kind of tangible proof of your engagement, it pretty much forces them to abandon their assumptions. If you're given simplified recommendations, challenge them directly. Ask, what additional therapies would you recommend if I were 45 with this same condition? I want to understand all available options, regardless of complexity. Use technology proactively during your appointments. Access your health apps, reference your digital medical records, or use your smartphone to look up medication interactions right there in the room. When doctors see you're comfortable with technology, well, it really challenges their assumptions about what seniors can do. And finally, request detailed written treatment plans and medication information. Just tell them, I want comprehensive documentation of my treatment options so I can review and research each recommendation thoroughly. This makes it clear you intend to be an active, informed participant in your own healthcare decisions. Now here's something really troubling. Medications are often prescribed as a form of behavioral control rather than genuine medical treatment. The most disturbing truth about senior healthcare is how these drugs are used to manage behavior, not to treat underlying medical conditions. Healthcare providers all too often prescribe psychiatric drugs, sedatives, and mood stabilizers to seniors, not because of any diagnosed mental health condition, but simply because these medications make patients easier to manage in medical settings and care facilities. Dr. James Martinez, who's a former nursing home medical director and now works as a patient advocate, has exposed this practice. He says, I've witnessed countless cases where medications were prescribed not to improve patient health, but to reduce staff workload. Anxious seniors got sedatives, assertive patients received mood stabilizers, and those asking too many questions were given antidepressants. It's chemical restraint disguised as medical care. The statistics are honestly just horrifying. Over 40% of seniors are prescribed at least one psychiatric medication, but only 12% have diagnosed mental health conditions that actually require pharmaceutical intervention. The rest of those prescriptions, well, they seem to serve administrative convenience rather than any real medical necessity. And these drugs, they often cause some pretty dangerous side effects, including falls, cognitive impairment, and even an increased risk of mortality. Consider for a moment what happened to 69-year-old former school principal Beverly. After her hip surgery, she became frustrated with the slow progress of her rehabilitation and started asking, detailed questions about her recovery timeline. The healthcare team ended up labeling her as difficult and prescribed her anxiety medication to help her relax. But the medication caused confusion and balance problems, which led to a fall that broke her wrist. So, while her original injury did heal, the complications from the medication actually extended her recovery by 4 months. The use of medication for behavioral control, it really does extend beyond just psychiatric drugs. Doctors routinely prescribe sleep aids for seniors who are simply experiencing normal age-related changes in sleep patterns, not actual sleep disorders. Pain medications are often withheld from seniors with legitimate pain complaints because, providers sometimes assume they're drug-seeking or maybe exaggerating their discomfort for attention. Blood pressure medications, too, are often prescribed at doses that cause dizziness and fatigue, making seniors less likely to be active or assertive during their medical appointments. And when patients do complain about these side effects, doctors tend to dismiss them as necessary trade-offs instead of, adjusting the medications or even exploring alternative options. Now, perhaps the most insidious aspect of all this is how these medications can actually create the very problems they claim to treat. For example, sedatives may cause confusion, which then gets labeled as dementia. Mood stabilizers, they can lead to apathy, and that often gets diagnosed as depression. And sleep aids, those can disrupt your natural sleep cycles, creating real sleep disorders that, oddly enough, require even more medications. Healthcare facilities, they often actively encourage this practice because, medicated patients just require less staff time and attention. Insurance companies on their end support it too, since psychiatric medications are cheaper than proper medical evaluations or, let's say, therapeutic interventions. And sometimes families even request it because they just can't handle their loved ones' very real emotional responses to health challenges. Your defense, honestly, starts with understanding exactly what each medication is for. Before accepting any prescription, you should always ask, what specific medical condition does this medication treat? What objective measurements will determine if it's working? And how will we know when to discontinue it? Try to avoid medications prescribed for vague reasons like anxiety or agitation if there aren't clear diagnostic criteria. It's wise to research every medication independently, using reliable medical databases. Look out for side effect profiles, interaction risks, and alternative treatments. You'll find that many behaviors prompting psychiatric prescriptions can actually be addressed through environmental changes, therapy, or by treating underlying medical conditions. Always demand specific treatment goals and timelines. Say, I want measurable objectives for this medication. If I'm not seeing specific improvements within a set time frame, I want to discontinue it and explore alternatives. This helps prevent open-ended use of psychiatric medications. Also, request medication reviews with independent pharmacists or geriatric specialists, as these folks can spot unnecessary drugs, dangerous interactions, and opportunities for deprescribing. Many seniors discover, sometimes to their surprise, that they're taking medications with no real therapeutic purpose. Make sure to document your cognitive and physical abilities before starting any psychiatric medication. Take cognitive assessments, balance tests, and mood evaluations. This baseline will help you spot medication-induced changes and gives you evidence if you need to advocate for discontinuation. And of course, create a support network that can advocate for you if medications ever affect your judgment or assertiveness. Choose someone who will question medical decisions and make sure your voice is heard, even if psychiatric medications alter your personality or cognitive abilities. The most heartbreaking reality in senior healthcare is how medical professionals calculate your life value when making treatment recommendations. Behind closed doors, doctors use economic formulas that weigh treatment costs against remaining quality life years, often resulting in seniors receiving inferior care not because of medical factors, but because of age-based value assessments. Dr. Patricia Chun, an ethics professor who has studied healthcare rationing, reveals the shocking truth. Medical training includes concepts like quality-adjusted life years that essentially assign numerical values to different lives. A 70-year-old's remaining years are calculated as less valuable than a 40-year-old's, influencing everything from organ transplant decisions to cancer treatment recommendations. It's systematic age discrimination disguised as medical economics. This valuation system affects treatment decisions in devastating ways. Seniors are routinely denied expensive procedures, cutting-edge therapies, and aggressive treatments not because they wouldn't benefit, but because the healthcare system has decided their remaining years aren't worth the investment. The same surgery readily offered to younger patients becomes too risky or not cost-effective for seniors with identical health profiles. Consider, if you will, 68-year-old retired engineer Walter's experience. When he was diagnosed with kidney failure, he was immediately directed toward palliative care and told that dialysis, might not be appropriate at his age. Walter had to fight for 3 months to access the same life-saving treatment that is routinely offered to younger patients. After he finally started dialysis, he returned to full activity levels and went on to live 7 more productive years. Years he would have lost if he just accepted the initial age-based treatment recommendation. The discrimination, unfortunately, extends to diagnostic procedures as well. Expensive imaging studies, specialized testing, and preventive screenings are often denied to seniors based on actuarial calculations rather than genuine medical need. Insurance companies and healthcare systems tend to use age as a primary factor in their approval decisions, just assuming that seniors won't live long enough to benefit from early detection or prevention strategies. Now, mental health treatment receives particularly harsh, age-based rationing. Depression and anxiety in seniors are often dismissed as natural responses to aging instead of being treated with the same therapeutic interventions offered to younger patients. Psychological therapy, psychiatric care, and mental health medications are, quite shockingly, considered wasteful for people who are assumed to have limited remaining time. The tragedy honestly deepens when seniors internalize these value judgments. After repeated experiences of diminished care recommendations, many seniors start to believe their lives are somehow less worth saving. They stop advocating for aggressive treatments, accept substandard care, and make end-of-life decisions based more on society's devaluation than on their own desires for continued living. Emergency room treatment reveals the starkest discrimination. Seniors presenting with identical symptoms receive fewer diagnostic tests, shorter examination times, and quicker discharge decisions compared to younger patients. Emergency physicians admit privately that age influences their clinical decision-making, with older patients receiving less comprehensive workouts. The economic calculations become particularly cruel around family discussions. Healthcare providers subtly influence families to choose less expensive care options for senior relatives, framing limitations as comfort measures or age-appropriate care. Families are encouraged to consider the burden of aggressive treatment without understanding the full range of available options. Your life has equal value regardless of age, and you must advocate accordingly. Always ask, would you recommend the same treatment if I were 45? If not, Please explain the medical, not economic, reasons for different recommendations. This forces providers to justify age-based treatment discrimination. Research treatment outcomes for your specific condition in patients your age. Many seniors have excellent treatment responses that contradict age-based assumptions. Bring this evidence to medical consultations and demand access to all appropriate therapies regardless of cost considerations. Seek multiple medical opinions, especially from geriatric specialists who understand senior treatment outcomes. Many conditions that prompt comfort care recommendations from general practitioners have effective treatments when managed by age-focused specialists. Use legal advocacy when necessary. Age discrimination in healthcare violates federal laws, and legal advocates specializing in senior rights can help you access denied treatments. Document instances where age appears to influence treatment recommendations. Connect with senior advocacy organizations that can provide support and resources for fighting healthcare discrimination. These groups understand the system's biases and can guide you through appeals processes and alternative treatment options. Remember that you have the right to refuse age-appropriate limitations on your care. If you want aggressive treatment, comprehensive diagnostic testing, or cutting-edge therapies, you can demand equal access regardless of your age. Your life value is not determined by actuarial calculations. Now you understand the 5 ugly truths about medical ageism that healthcare providers never wanted you to discover. But here's what changes everything. Knowledge is power, and you now possess the tools to transform every medical encounter from passive patient to empowered advocate. Remember Walter, who fought for dialysis and lived 7 productive years that doctors wanted to deny him? Beverly, who overcame medication-induced complications to reclaim her recovery. These aren't exceptional cases. That's what happens when seniors refuse to accept discriminatory treatment based on age alone. Every time you challenge age-based assumptions, demand equal treatment, or advocate for comprehensive care, you're not just fighting for yourself, you're changing how the entire healthcare system treats seniors. Your assertiveness creates ripple effects that benefit every older adult who follows. The medical establishment hopes seniors will remain passive, accepting inferior care without question. But you're different now. You recognize the biases, understand the discrimination, and possess strategies to overcome both. Your health, dignity, and remaining years are too valuable to surrender to age-based prejudice. Transform your healthcare experience starting today. You deserve medical treatment based on your individual health profile, not stereotypes about your age group. If this exposed the healthcare discrimination you've experienced, smash that like button and share this video with every senior who deserves better treatment. Your story could save another senior's life. Comment below. Have you experienced medical ageism? What will you do differently at your next appointment? Let's support each other in demanding equal healthcare. Subscribe and hit that notification bell right now, because every senior deserves dignity, respect, and life-saving medical care, regardless of age. Together, we are changing healthcare forever. Like, subscribe, and let's keep fighting for the respect we deserve.